Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello Sports Medicine Report. A rib subluxation is the medical way of saying that there is a misalignment of a rib. You will often hear people say, my rib is out. Now the joint is intact. There is not any ligament damage or any muscle damage, but the joint is not functioning properly. It is often termed there is dysfunction in the joint. It is lacking its proper motion. That's what a subluxation means. So I'm going to speak about a rib subluxation. This is a condition that can be very painful. The pain can be felt in the back where the rib articulates with the spine, or it can be felt all the way along the rib to the side, to the front, and even where it articulates with either the sternum or with the costal cartilage. The symptoms of a rib subluxation include pain, which can be intense, tightness, spasm, hypertonicity, which is the medical name for extreme muscle tightness, limited pain-free range of motion, and point tenderness. Point tenderness means that you can press on an area or just put pressure on an area and there is pain or tenderness felt. Another symptom is inability to take a deep breath. Therefore, because of the pain or because of the lack of motion, you are unable to raise the ribcage and take a deep breath in. These symptoms are aggravated by coughing, sneezing, lifting, twisting of the spine and rib cage, overstretching, rotation of the spine and rib cage, lateral flexion, which is bending of the spine or rib cage, throwing motions, motions involving torque such as a baseball swing or a racquet swing, reaching overhead, and exercises such as bench press, pullovers, and dips. The pain and symptoms of a rib subluxation can be located in the anterior aspect of the rib, the posterior, the lateral, or all along the entire bone, or at either one of the joint articulations of the rib, which I stated before can be in the back where it articulates with the spine, or in the front where it articulates with the sternum or the costal cartilage. And this is an injury that can be recurring, meaning that it can occur over and over again. The source can be traumatic or non-traumatic. Many times when it is non-traumatic, it is because of improper use while training, especially while weightlifting or performing resistance training. One of the main contributing factors of a recurring rib subluxation is hypertonicity of the serratus anterior muscles. The serratus anterior muscles are also known as the boxer's muscles, and they can be seen on boxers, bodybuilders, or anyone who has low body fat. If this muscle is hypertonic, meaning that it is very tight, it often pulls on the ribs and can cause the rib subluxation. The origin of a rib subluxation can be either posterior at the costovertebral joints or anterior at the anterior costochondral joints. Prevention, prevention, prevention. As I say in almost every one of my videos, prevention is easier, faster, and less expensive than rehabilitation. So perform every exercise that you can to make sure that you are preventing a rib subluxation. This is a painful and performance limiting condition, especially since it is a recurring condition if you don't get this taken care of. So use every tool you can to prevent the origin of this condition, and use every tool you can to prevent a recurrence of a rib subluxation. Disclaimer alert. Viewing this video does not take the place of seeing a medical professional. If you have or think you have a rib subluxation, please see a medical professional, especially a doctor of chiropractic, to help you to eliminate the source of the rib subluxation. Please see a medical professional. Do not hesitate. If you are performing prevention or rehabilitation exercises for a rib subluxation, you can work with a certified fitness trainer or a certified strength and conditioning specialist. Never perform an exercise that elicits or intensifies symptoms. If an exercise elicits or intensifies symptoms, please stop immediately and find a viable substitute. Perform all exercises through a symptom-free range of motion, even if that motion is very small. Start any type of exercise program at your current health, fitness, and strength level. Do not start at the level you used to be at. Please start at your current health, fitness, and strength level and increase the intensity and the volume of your training in small, gradual, calculated increments. As a doctor of chiropractic, I have seen many patients with a rib subluxation. Again, a nickname for the rib subluxation is that there is a rib out. That means that the rib is not moving the way that it should. There is dysfunction at the rib joint, either where it articulates with the spine or where it articulates with either the sternum or the costal cartilage. See a doctor of chiropractic. As a doctor of chiropractic, I would do an evaluation on the cervical spine, which is the medical name for the neck, the thoracic spine, which is the medical name for the mid-back, and the lumbar spine, which is the medical name for the low back. I would also perform an evaluation on the entire rib cage and on the shoulder complex. Anything that can be contributing to this condition, I would evaluate. I would give the patient the diagnosis, and then I would perform the treatment. The treatment will consist of a chiropractic adjustment. The chiropractic adjustment is going to help to restore proper skeletal motion and help to optimize nerve flow. If you have been diagnosed with a rib subluxation or you think you have a rib subluxation, please do whatever you can to rehabilitate this condition by eliminating the sources of this condition. You can perform stretching exercises of the serratus anterior. I already did a video on this, so I am going to, actually I did 2 videos, so I'm going to provide links to those videos. Also, you can perform self-muscle work with mild pressure on the serratus anterior. Both of these techniques will help to lessen muscle tension, which may contribute to the elimination of the source of your rib subluxation. To prevent and rehabilitate a rib subluxation, you can also perform normal breathing exercises. This will teach you to use the diaphragm while performing normal breathing, and you can also strengthen the scapular retractor muscles. The scapular retractor muscles include the rhomboid minor, the rhomboid major, the middle trapezius, and the lower trapezius muscles. You can build strength and endurance in these muscles to help to eliminate the contributing factors of a rib subluxation. Thank you everyone for watching today's episode of Dr. Ozello Sports Medicine Report, where I covered the rib subluxation. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. You can visit my website, championshipchiropractic.com, where you can get additional information on the book, and you can also find my blog. My blog contains articles on spine health, chiropractic care, sports medicine, nutrition, health, and fitness. Please feel free to like this video. You can leave any questions, feedback, or suggestions in the comment section below. Please subscribe to my YouTube page, and always remember to train hard, but train smart. Get adequate rest between your training sessions. Utilize nutritional and supplementation strategies that work for you. Work hard to prevent and rehabilitate injuries and accomplish your goals.